So please welcome Dr. Ralph Alvarado to our conference today.
Well, thank you for that very kind introduction. I hear that. I think I got to update that. It's going to be 30 years, I think, with my wife in June. So 33 decades is a long time, and very happily married. My wife is my better half, and if I could, my mom and my brother are visiting from out of town today, so they're going to be flying in. So she's out there picking them up. So otherwise, she'd be here because she enjoys coming to a lot of these things. So first of all, I want to thank the sponsors of today's Aging Conference. I want to thank Tennessee State University and your leadership team, President McPhee, Provost Burns, Director and co-founder of the Positive Aging Consortium at MTSU, which is Dr. Deborah Lee, and also want to acknowledge the work of the Conference Planning Committee. I know it takes a lot to put a lot of these things together. Today I'm pretty thrilled to highlight the Tennessee Department of Health's role in promoting healthy aging. We're committed to prioritizing healthy aging as a core public health issue and supporting it across all life stages. And our efforts aim to enhance the quality of life and health outcomes for older Tennesseans, starting before individuals reach the ages of 50 or 60 years of age. We have to identify opportunities to reduce risk and boost protective factors across various life stages, from gestation, from the womb, all the way into adulthood. And for instance, we can control modifiable risk factors for dementia and Alzheimer's by avoiding smoking, adopting a healthy diet, maintaining heart health, managing chronic diseases. A little bit about my background you've already heard. I am a physician. I'm in internal medicine and pediatrics. And when I first got out of training, I wound up setting up a traditional medical practice in Kentucky, kind of in a rural community just outside of Lexington. And I would take care of babies in the nursery all the way to adults as they got older, and started realizing that as people did get older, they went to the hospital. I was still a traditional hospital doctor, that when they got sick to go to a nursing home, I would follow them there. And so I got privileges at skilled nursing facilities and was helped take care of people in that setting. More of a courtesy to my patients who wanted to see a familiar face in that environment, and quickly realized there were a lot of docs, a lot of colleagues who had no desire really to go to long-term care. They just viewed the nursing home as kind of another world, and they heard negative comments about what was happening there. And you quickly realized in that setting the amount of commitment of the people that are there, the passion of the people that work in those settings. And it's getting more and more difficult to find people who share that passion to do that. And so I kind of got into that realm and started appreciating a lot of the difficulties that people had as they got older, of how to tap into resources, and sometimes how they became a forgotten world. I think a lot of doctors in hospital medicine view folks there like being as part of a hospital setting or environment, and you don't have those same resources. And when you hear Dr. Lee talk about how people in public health have to do more with less, nursing homes are kind of that environment these days in modern medicine. Obviously, as a physician, I was a clinician, wasn't really thinking about politics, got asked to run for office back in 2004, ran twice for State House, lost, ran for State Senate twice. I was asked to do that, and much to my wife's chagrin. But the fourth time we ran, we finally got in and had about 10 years of pent-up policy and got a lot of things accomplished. It started a journey that I would have never expected. And then once we had an opportunity to speak at a national convention, ran for lieutenant governor with Governor Bevin and got to meet Governor Lee during that time. And then when this opening kind of arose, the governor reached out and says, hey, I have an opening for Commissioner of Health. Why don't you come to Tennessee and serve in this capacity? And I thought, I don't know anybody in Tennessee. I'm a Kentucky guy. We're always chasing Tennessee. It was always the vision I had. And when I remember I came down and interviewed with the governor, he said, so why do you want to do this role? I said, I don't know that I do. I said, you asked me, and, I'm interested. But I do know that philosophically and politically, I share a lot with the legislature here, with the governor's team, and really a state that's growing, and a state that's gotten 7 million people in it now. So it's growing, it's larger, people are moving to this state, a lot of things are being done right. And there's an opportunity, if you want to improve health, that if things happen in Tennessee, surrounding states are watching. So if you want to have an impact, there's an opportunity to have an impact here that might not only affect Tennessee, but also the region. And when you first come in as a commissioner, I realize I have a very good staff. I would argue the best staff in state government, and I would defend that because I know the statistics, and I've met people from other staffs of state government, and we do have the best. But they often ask, what's your priority going to be when you come in as a health commissioner? It's easier when you live in a state and you're here all the time and you kind of know the ins and outs and what's going on to be able to answer that question. But when you're coming in from out of state, and kind of rely on the things that you know. And one of the things I think that we started seeing on a national movement is, after the pandemic in particular, is the need that we have for helping people kind of age in place and for healthy aging. And that was one of the things that I talked about. I talked about food insecurities, which is a growing problem in our state, and then also a cancer, which is probably one of the leading causes of death for people in Tennessee, and a lot of things that can lead to that. But aging was one of the things that were very important. And so you have to rely on statistics for some of that. So I thought I'd go through some of the statistics, and I think the provost covered a few of those things already. But we have a total of 7 million plus people in the state of Tennessee right now. People that are age 65 and older is 1.2 million people. So that's about 17% of the total population. Older adults are the fastest growing demographic in the United States. In less than 10 years, older adults are projected to outnumber children under 18 for the first time in U.S. history. And I want to say, I've seen some stats that's saying in Tennessee it's already there. Alzheimer's disease is the 7th leading cause of death in Tennessee, 2,879 deaths from Alzheimer's disease. About 130,000 people age 65 and older with Alzheimer's. Of Tennessee's 370,000 caregivers, which is a group that we have to talk about when we talk about aging in place, 67% are experiencing chronic health conditions, 30% of those folks with depression. And all of us can think of friends or family or people that we've seen. I know my neighbors back in Kentucky, a great friend of mine who I've watched go from a kind of a thriving guy and saw dementia kind of consume him, and his wife struggle really with how do I manage the process, and people who had the means but just didn't have the connections and would come over all the time, what can I do, asking for help in that regard. And that's common, and those individuals ignore their own health, and if something happens to them, what happens to their loved one? In 2023, America's Health Rankings Senior Report ranked Tennessee 42nd nationally for older adults. And I often talk about public rankings, and we're very proud of our rankings in Tennessee. We're one of the top 3 to 5 states when it comes to our taxes, a great place to start businesses. People are moving into the state in droves. We like our basketball rankings, our football rankings, our baseball rankings, all that is great. But when it comes to public health outcomes, we're bottom 10 in most categories. And again, in care for the elderly, 42nd. We have a higher rate of early death, we're 44th. Higher prevalence of smoking, 49th. Mental distress, 47th. Community support and engagement, 44th. Multiple chronic conditions, 40th. And in food insecurity, 37th. We just saw the video here a few minutes ago talking about pickleball, which has been great for people that are older, and my staff smiled because they looked at me. I had a boot on my calf when I went out and played pickleball with my son for Father's Day last year and tore a muscle. $400 million worth of injuries now. It's great that people are getting out there and exercising, but they got to make sure they warm up if they're not used to it so they don't blow out knees and ankles and all kinds of things. But we're also hearing a lot about social isolation and loneliness, and our Surgeon General's talking about loneliness and how it's becoming an epidemic, not only for people that are older, but for younger adults as well, and kids anymore. One of the things I want to throw out there just as an idea that we've seen, and I think we talk about people that are older, and just had a discussion with the Nashville Healthcare Council Fellowship about all the generations and how they identify, and how this generations that are coming up now are often more disconnected, have less friendships, less interactions because they rely on their phones for most of their interactions, and how some countries are handling the rising mental health issues that we're seeing. A country like Zimbabwe that doesn't have a lot of mental health professionals has decided to tap into their older generation to assist with that, where they take folks that are retired, perhaps don't have a lot of connections with folks, giving them very basic mental health training, putting up a bench in the middle of a village, and having that older person just come in and sit down and be there, and calling it the friendship bench. And they're watching young people from their community come to have someone to talk to sit down. And we often think about grandparents in our lives that we may have gone to for advice or just to hear grandfatherly or grandmotherly advice. There are places in the world that are using that and tapping into our older generation that perhaps isn't in the workforce, but can still provide that wisdom and those thoughts and ideas that we so desperately need sometimes in a world that's getting more difficult to exist in. Social isolation alone increases the risk of heart disease, infections, depression, cognitive decline, death, and increased risk for elder abuse amongst older people, and was exacerbated by the COVID-19 pandemic. And loneliness also shortens life by 15 years and is the equivalent of smoking 15 cigarettes a day, and is more dangerous than obesity. Social isolation increases an individual's risk of dementia by 50% as well. And the COVID-19 pandemic heightened vulnerability amongst older adults, both due to infection risks and the consequences of social isolation. And before the pandemic, healthy aging wasn't a primary focus for many public health agencies, despite the increasing population of individuals that are ages 65 and older. The pandemic has spurred increased collaboration with partner state agencies, health systems, community providers, private and nonprofit organizations, and disability coalitions to offer care and support to older and disabled Tennesseans. So here's how we're strengthening our department's commitment to improving the health and well-being of older adults and caregivers. In less than 1 year as the state health officer, I've expanded public health practice in healthy aging through policy change, enhanced older adult data collection, and multi-sector collaboration rather than operating in separate divisions, offices, and programs. In the summer of 2023, the national organization Trust for America's Health designated the Tennessee Department of Health as an advanced age-friendly public health system for implementing a public health framework within our department's activities to support the health and well-being of our older adult residents. Age-friendly public health systems create the conditions at the national, state, and community levels that older adults need to live safely, healthfully, if that's a word, and productively as well. And we're broadening our partnership with regional and local health departments to involve them in the age-friendly public health system, with 19 local health departments already in West Tennessee that are currently pursuing this designation, and I would anticipate that all of our health departments are going to be obtaining this designation within the next couple of years. There's several examples of how I want to continue to operationalize healthy aging as a core function of our work. Our state health plan framework focuses on a pathway for achieving our vision, which is healthy people, healthy communities, and healthy Tennessee. And this incorporates healthy aging across multiple sections, but most notably under a healthy life, where there's a specific older adult kind of priority area there. And for the first time, our internal 4-year strategic plan is now inclusive of older adults. And we utilize the community health assessment process to assess and prioritize local public health concerns, with each local health council identifying 3 priority issues like mental health, tobacco abuse, or obesity, and developing community health improvement plans, we call them CHIPs. Increasingly, these plans address the health needs of older adults within their communities. Our work through the Tennessee Livability Collaborative and our community health improvement plans also utilizes data to ensure that we focus on supporting the needs of all Tennesseans, including older adults, in our activities in every community across Tennessee. Another important element, something I'm very proud of the governor doing, is involving our faith communities as well. He has kind of an office of faith-based initiatives, which is tremendous. I know growing up, my father always told me that he always looked back and said, government has been increasing their role and kind of growing and taking things away from what our church and churches used to do on their own. And so now I think there's an acknowledgement there's a lot of work that's being done to meet people's physical needs and an opportunity for government to partner with our faith-based communities to help meet people's physical needs and work together. And so we're recognizing these communities as an essential to really our public health mission. This is why we value the partnership with the University of Chattanooga's School of Nursing and other partners to implement a statewide initiative to empower faith-based and religious congregations to provide aging community members and their caregivers with health and wellness programs and support. We're actively involved in the development of Tennessee's multi-sector plan for aging, which is being led by the Division of TennCare, or Medicaid. And the plan is a cross-sector, state-led strategic resource that helps transform the infrastructure and the coordination of services for our state's rapidly aging population. The CDC awarded our department another 5 years of grant funding to continue our efforts in Alzheimer's risk reduction, early diagnosis, and treatment for Tennesseans diagnosed with Alzheimer's as well. And as we continue to prioritize our work to ensure that we're promoting healthy aging and increasing the proportion of Tennesseans who are healthy at each stage of life, we're also implementing a healthy aging roadmap that is a long-term vision for supporting older adults. I think when I got here, I met with a lot of our groups that are out there doing work in this space, and I noticed it was kind of a lack of vision. And sometimes when you come with ideas and you say, hey, we want to help older Tennesseans, if you go to our legislators with that, they'd say, that's great, tell me what to do, I want to help out, but they don't know exactly what to do. And so we've put together really a compilation of ideas that are being done in other states, so nothing necessarily new, but things that we know are effective. And we're hoping to have a lot of those. There's kind of a section on things that are more aspirational, to work on things like food insecurity and housing and transportation, and then other things that are shovel-ready programs right now on things that are kind of related to Alzheimer's disease and related dementias, for early detection and diagnosis, healthcare workforce development, which is a desperate need right now in healthcare, and also caregiver support. Right now, we know there's a lot of transformation being done with our Tennessee Commission on Aging, which is being absorbed by DIDD, one of the departments for intellectual development and disabilities, and kind of combining those. We're working in partnership with them to see how we can implement this 5-year road plan moving forward as well. We also have an internal team that's tasked with pinpointing common priorities with the age-friendly ecosystem, which refers to a community or an environment that is designed to accommodate and support the needs of older adults. And the goal of an age-friendly ecosystem is to create an inclusive and supportive environment that enables older adults to live independently, to actively participate in community life, and to maintain their health and well-being as they age. The ecosystem includes national frameworks like age-friendly public health systems, AARP's age-friendly communities, age-friendly health systems, and age-friendly universities. And our goal as partners is to dismantle barriers between sectors and shape community or regional frameworks to improve the health and well-being of older adults and their caregivers. So we affirm all people are valued, respected, and deserve to live in healthy, safe communities that meet their needs for their whole lives. And I recognize the significant age-friendly work that's occurring across Tennessee to implement programs and services that help older adults, people with disabilities, and family caregivers to thrive and to remain socially active as they age. I mentioned our vision earlier, which is healthy people, healthy communities, healthy Tennessee. And this allows us to align initiatives across state and local government agencies and the private sector to facilitate genuine collaboration amongst diverse stakeholders, to raise awareness among policymakers and the public, to establish statewide priorities, and to incorporate aging priorities beyond traditional healthcare and community services. Tennessee really has an unprecedented opportunity to be a state where older adults, people with disabilities, and family caregivers can age in place and live in dignity. And our department is ready and willing to support these efforts and to continue this conversation with you as we move forward to our continued partnership and support your regional initiatives. Before I conclude and give my thank yous, I want to mention one idea that I don't know how many of you have Netflix. I imagine most of you. I see the younger people nodding their heads, even some of us who are older. But if you have Netflix, I'm going to give you a homework assignment. Is to go home and look up Blue Zones. Maybe some of you may have heard of Blue Zones, or if you haven't, type it in the search engine. It'll show up a thing on Blue Zones. And I think it's a really interesting idea because it's the work that public health does. And when it came off on Netflix, this is a concept that's been around for 30 years. Blue Zones are, it was kind of an idea by National Geographic. There was a family called the Buettner family that had bicycled around the entire world. And so they had seen a lot of places in the world and reported back. And National Geographic said, hey, we want you guys to go out and find the Fountain of Youth. And so they went out to find it. And of course, they didn't find the Fountain of Youth, but they did find locations in the world where people were living to the age of 100 or older at 10 times the normal level. And they said, why would that be? What's happening there that would make that difference? And one of those places was my alma mater, Loma Linda University, or Loma Linda, California, where Loma Linda University is, but also Nicoya, Costa Rica, where my dad is from. They also found Ikaria, Greece, Sardinia, Italy, and Okinawa, Japan. And they went there and said, what's common about these folks that are living here to 100 years of age? And there's some common themes. Some of it is just natural motion, that people are just naturally moving. We talk about people having to exercise. These folks don't perceive it as exercise, but they live in places where they have to walk up a 20-grade incline, and they're in their 90s. They've been doing it their whole life. They just keep doing it and maintains a lot of their activity. A lot of it is the foods that they're eating, natural foods that they've eaten their whole life. In Japan, they're eating a kind of a sweet potato or it's a purple yam that they've eaten. The people that were poor, that's all they had, but very high in antioxidants. People in Italy eating a minestrone soup, very high in antioxidants. I keep joking that if in Tennessee we could just put antioxidants into biscuits and gravy, we would all be set. But they would do eat these kind of natural foods. And they, in Greece, they were drinking some type of a wine that was there. They all have a sense of community. If you watch the video, the ladies in Japan are in their 90s. They've been hanging out since they were 14 years of age, still arguing about the men in their lives together, but all enjoying a sense of community that they've grown up with. They all have a sense of faith. They all believe in something more than themselves. And they also all have a purpose every day when they grow up, when they wake up. They all have something that they strive to do. They're either volunteering in their community, they're helping in some regard. And I think that's very important that all those folks living to that age, if we want to have something similar, that's starting to catch some fire here in our state. We've got some of our communities, Sevier County, I think their local officials have watched this. When I put this out for my department to watch the video, just as an idea, because it shares a lot of the things that we've been doing as a department. It gathered some interest, and we had some of our staff who said we've already been working on this with our local government. And they're getting ready to implement that and trying to create a blue zone in parts of Tennessee. Once that happened, we started having Hamilton County interested, Washington County is interested, Haywood County now is interested. And so we're hoping that as people look into this, if they study it, they go, hey, we'd like to see that happen in our community, to have an opportunity to live as long as we can and live a productive life. And to realize that as folks get older, that they're not just something that we discard often, and that people have a certain vision, that the people have full of wisdom, plenty of things to offer us that we can still learn from, and they can help us as we all live our lives as well. So I want to thank you for putting this together. Thank you all for your hospitality, having me here to say a few remarks. And like I said, if any of you have any ideas, plans, concepts, things that you're trying to get done, know that we're a very willing partner. It's part of what we're going to be doing moving forward as a Department of Health, and looking forward to helping people here live as long as they can. Thank you all so much for your kind attention.